So today we are going to start with the writing subtest. In this class, we have total time of 45 minutes time, right? In total, and the first 5 minutes we are not allowed to write anything anywhere. Okay. So this is your just the reading time. You have to read the case notes in this. So in this 5 minutes time, you have to read the case notes. Then we have 40 minutes time to complete the writing task. So in this 40 minutes time, you have to read and write. Number one, the case notes will remain with you. Like you can see the case notes. Like time again and again. So this is not the case that they will take the case notes from you, but the case notes will remain with you throughout the time. Okay. So first of all, the most important thing is the marking criteria. We'll discuss that there are 6 points that you have to see and understand. The first one is purpose of writing. The second is the content. The third is the organization and layout. This is the third part. The fourth is your, you can say, conciseness and clarity. This is the fourth criteria. The fifth is your genre and style. And sixth is the language part. So based on these 6 points, you will be, like your letter will be graded. So first of all, before we can proceed further, based on the understanding of ours, the reference to OET writing, these are very important criteria. The first four. So try your level best that you should not make any mistake in this part. So what we have in this part, we are going to discuss that as well. In these four criteria. The first of all, what we have in the purpose of writing. Let's say to begin with, in the purpose of writing, we have two routes that has to be followed. The first of all, you have to see who is the recipient, right? In any type of letter, you have to ask yourself to whom I'm writing this letter. The second thing that you need to see, what is the issue? Like, what is the reason of writing? What is your reason of writing? You have to see this thing clearly that why I'm writing this letter. So, where we can find this purpose of writing, let's say if this is your case notes, on the bottom left corner, like this part, you will find the instruction such as writing task. In here, there will be a guideline given to you that you are writing this letter to blah and blah, okay, for further management and so on. So at least you can identify the first point in the purpose is to whom you are writing this letter. This is the first point, right? In the last part of the letter over here, maybe we have 2 pages. So in the last part, you can find out the reason of writing most of the time. So I will show you the letter as well. So the first thing that is the purpose of writing. Right? Anyhow, the second thing there, the second part that do depend upon the purpose of writing is the selection of the case notes. That we can say is the content. So what we have in the content part, you would see relevant information. You can also see semi-relevant, and you can also see irrelevant, right? So we have some relevant, semi-relevant, and irrelevant information. Okay. So this is the second part of the criteria. Again, it should depend upon the purpose of writing. So what we have 2 points to whom we are writing and for what we are writing. So whatever point, is it relevant for that person, or is it irrelevant or for the issue, or what? We have to see this thing as well. The third point is the organization of the notes and layout. Remember that sequence of the information given in the case notes it should not be the right sequence always. So according to the notes, you have to sequence according to the information, or sequence should be according to purpose, right? So this is the organization that depends upon task to task. Accordingly, you'll organize them. Now we have the next thing in the layout, in the organization part. Layout mean like the formatting, the format you like follow, the paragraphing, and so on. This is the part of your, you can say, layout. Okay, how to write down the date and which format. We'll discuss that as well. Then we can see that we have the conciseness part, conciseness plus clarity. So first of all, conciseness mean to summarize all the relevant but less important detail, right? So you should develop your skills to summarize. Normally we use perfect form of the tense while summarizing this information. Now clarity is the simple word is the flow. We also need the connecting devices. We also have to learn the clubbing. Clubbing mean write the same information together, right? Then we have the genre and style. So first of all is the transformation of the case notes in technical language, or in simple word, as per the recipient, you have to transform. Jargons, or what we can say, not jargons. You can say that we have not to use the abbreviations, are not appreciated. Abbreviations are not appreciated, okay? In this part, signs such as this one, this, this, these are not appreciated. Language like, let's say, mene, BD, prefer to write in full form, but you can write it as well. So, and the tone should be polite in the Yarn style. And remember that this is the technical writing, right? This is the technical writing. So, according to the formality, you have to follow the format. The last part is the language. In the language part, we have tenses, we have sentences, and we have parts of speech. In tenses part, you can see mostly we use past tense, maybe in the simple form, or maybe perfect tense, either past or present. In sentences, we have different clauses, right? We can use simple, we can use compound, complex, and so on. And then use of appropriate preposition, noun, verb. as well is the language part. And you can see that as per their guideline, the purpose of writing carries like the marks like 0 to 3 out of the rest of the criteria hold between 0 to 7. And whatever weightage they do give in percentile system, you have to score 20 out of 2 out of 3 in order to qualify. And now 0 to 7, you have to take 5 out of 7 in order to qualify the score. Anyhow, so this is about the marking criteria. You should go to the bottommost part. Let's say this is a letter. You should go to the bottommost part, and we have to see to whom we are writing this letter. Let's say here we are writing this letter to the emergency registrar, right? This is the one of the concern that you have to see in the purpose of writing. And last visit, you need to see the assessment part. We have differential diagnosis. The first DD is AMI, and the second DD is APO, acute pulmonary edema. Along with that, his asthma is worsening, right? So this is your first DD. Okay, so we can do one thing. Let's say we can start from this point that at least we have an idea. Now we are writing this letter to the emergency registrar, and the reason of writing is this AMI or APO. This is the main reason of writing, along with worsening of asthma. Why we are writing this letter? Okay. Now with reference to that, we can also see that it's a transfer letter to the emergency department. At least we have an idea that this is kind of emergency transfer or referral letter. Now we can start it in the case notes. Name of the patient is important. Let's say age is also important factor. Complaint of mild central chest pain, important point. Mild asthma, important. Family history, important negative. We write it down. One pack day smoker and drinks 10 standard drinks 5 by 7 mean 5 days a week, important. Upper significant stress, important. Stress related pain, okay, fine. We can see everything was important. We can also see here at that time we were suspecting it to be early stage of ischemic heart disease. ECG was normal, important negative. We write it down. We run some tests, okay, and then we can move on to the next visit. Still, he came to you with worsening of asthma and same chest pain. Ischemic changes was present on exercise test. Wheeze was there. Cholesterol was increased mildly. You were suspecting ischemic heart disease. Then you prescribe some medicine and ask the patient to see me again after 2 weeks. After 2 weeks, he presented again with chest pain. He was having worsening of asthma. You consult the patient for something. He, however, presented again on today visit with acuteness of symptoms like crushing chest pain, worsening of asthma, ECG positive, lung heart finding positive. So you can see that these are the plan that we have to write it down. Now in terms of sequence, if you can see the case notes, you can see almost the first 3 visits in this particular letter are less important. Okay, so less important details should be summarized. Less important details should be summarized. So irrespective of like whatever the format you will be following, either chronic to acute and acute to chronic, that is something else. This is something that we have decided now that the first 3 visits of this letter would be summarized, right? The reason is that we have acuteness of symptom in the last visit. Okay, and then we have to pay focus on the today visit. You have to expand it, right? Now that what we can follow the format, we can write down the name of the doctor on the top left corner. Then we can write down the designation. Then we have the address. We have Lakes Road. In this format, we can write it down the address, right? On the top left corner, there is no comma over here. Afterward, you can write down the date, which could be exam date, or in the recent exam, they would have written the date on which you can assume the date actually, let's say. Anyhow, whatever the date that has been written in the last visit, 5/5/11, you can write down the date over here. Date can be written over here as well on the top left corner, right over here. After that, we can just write it down. The patient detail regarding maybe Mr. John Elvin, comma, or age, let's say 38 years, or date of birth. Whatever is given to you, you can write down over here. Okay, there is no, let's say, this should be in the one line. Anyhow, afterward, we can write down the introduction. So, to introduction to this letter would be, let's say, thank you for seeing Mr. maybe John Elvin, or you can write down Mr. Elvin as well, it's your call. Let's say I'll be giving examples for that. A 48-year, let's say, old male patient. We can put comma over here if you wanted to. Whose, let's say, we can also write it down signs, symptoms, and features, sorry, and investigations are suggestive of. Yeah, if we have mentioned, we cannot mention. I add. Okay, so signs is suggestive of. Let's say we can write it down in full form, or so this will be the introduction. We can write it down. Thank you for seeing, Mr. Elvin. If you have done the age, you can cut it down, maybe, or we can write it down. Businessman. You can also write it down. A businessman. Let's say. So in here, you can write it down. The introduction in this way. Afterward, as is in the other format, So we can write it down after introduction. Let's say today, Shalvan, while he was telling. You can see that in this letter of introduction, we can write it down today. Shalvan, when he was close to the center, he developed, let's say, put comma, he developed sudden onset of crushing chest pain. Despite the administration of Anjani, his pain did not relieve. This is one of the way. So write it down. Then we can write it down, let's say, worsening of asthma on, let's say, cardiac examination. We can write it down the ECG finding. Then we can write it down, maybe you can say, pulmonary examination as well. Like on cardiac examination, his ECG showed a mild elevation. Then we can write down about the bilateral cracks and so on. After writing this paragraph before making diagnosis, we'll write a overview as well. Like how we can write it down. Previously, he had visited us thrice the complaint of mild chest pain and okay, apart from, let's say, ischemic heart disease, we can add in full form, confirmed on exercise tolerance test, we can add in full form. All of his are suggestive of okay, all of the investigations, including ECG, remained normal. Okay, then we can write down his asthma has also worsened over a period of 3 weeks due to non-control dependence, right? Then we can write it down in the one paragraph like Mr. L1, a pack cigarette smoker with 5 days history of drinking. To write it down the point as well, he has a negative family history of cardiac disease, and then you can conclude it. In view of the above, I am transferring this patient by ambulance, and during transfer, he has been given, let's say, GTN patch and blah blah in view of her risk of, let's say, AMI or APO along with worsening of asthma. Then you can use sign of statement. Please do not hesitate to contact me if you have any further queries. Right? This is one of the format. The second format is that after writing the intro, right? We can start directly from the overview, or it should be overview, then today, and then conclusion. Both are right. So I hope it's clear to you. Part, let's say, you can also write it down the previous history and the socio-economic details. Right? Any question that you want to ask?